Question 1. To address the challenge of a wilderness expedition team becoming disoriented in dense forest with rapidly deteriorating visibility due to fog, what is the most appropriate best practice approach to re-establish their location and safe passage? Option A. Attempt to use a single, potentially unreliable electronic navigation device without verifying its readings against any other available information or the surrounding terrain. Option B. Immediately halt the team. Deploy all available navigational tools, map, compass, GPS, altimeter, cross-reference their readings and collaboratively determine the most probable current location and a safe bearing to a known landmark or exit route. Option C. Continue moving in what is perceived to be the most likely direction of travel, hoping to encounter a recognizable feature or trail as visibility remains poor. Option D. Rely solely on the team leader's recollection of the terrain and general direction, assuming they can retrace their steps without consulting any navigational instruments. The correct answer is B. Immediately halt the team, deploy all available navigational tools, map, compass, GPS, altimeter, cross-reference their readings and collaboratively determine the most probable current location and a safe bearing to a known landmark or exit route. Explanation. The scenario presents a common wilderness medicine challenge. A team experiencing disorientation in complex terrain with deteriorating weather. Professional challenge lies in the immediate need for effective navigation to ensure safety and prevent further escalation of risk, while also managing potential team stress and resource limitations. The FAWM curriculum emphasizes evidence-based practices and ethical considerations in wilderness environments. The correct approach represents best professional practice because it prioritizes a systematic, multifaceted strategy for re-establishing orientation. This involves leveraging multiple navigational tools and techniques, cross-referencing information, and engaging the team in a collaborative problem-solving process. This aligns with the FAWM emphasis on preparedness, risk management, and the ethical duty to provide competent care, which includes ensuring the safety of the expedition through sound navigation. The FAWM framework implicitly supports the use of all available and appropriate navigational aids and techniques to achieve the safest outcome. An incorrect approach that relies solely on a single, potentially compromised navigational method, e.g., a malfunctioning GPS without backup, fails to meet the standard of care expected in wilderness medicine. This demonstrates a lack of preparedness and an over-reliance on technology, which can be unreliable in remote environments. Ethically, this constitutes a failure to adequately assess and mitigate risks, potentially jeopardizing the well-being of the team. Another incorrect approach, such as attempting to navigate based on vague recollections or assumptions without verifying with reliable data, is equally problematic. This disregards the fundamental principles of accurate navigation and introduces a high degree of uncertainty, increasing the likelihood of becoming further lost. This directly contravenes the ethical obligation to act with due diligence and competence. A third incorrect approach, such as continuing to move without a clear plan or consensus on the intended direction, exacerbates the situation. This reactive and uncoordinated movement can lead to increased fatigue, further disorientation, and potential accidents. It demonstrates a failure in leadership and team coordination, which are critical components of wilderness expedition safety. The professional decision-making process in such a situation should involve 1. Immediate halt and assessment of the situation, location, conditions, team status. 2. Systematic evaluation of all available navigational tools and techniques. 3. Collaborative decision-making with the team, leveraging collective knowledge. 4. Establishment of a clear, verified plan before resuming movement. And 5. Continuous reassessment of position and progress. Question 2. The monitoring system demonstrates a significant drop in ambient temperature and an increase in wind speed, coinciding with a patient presenting with altered mental status and shivering. Based on FAWM wilderness first aid protocols, which of the following is the most appropriate initial management strategy? Option A. Immediately begin active rewarming measures using available insulating materials and provide warm, sweet fluids if the patient is conscious and able to swallow. Option B. Administer a high-energy carbohydrate snack and encourage vigorous physical activity to generate internal heat. Option C. Focus solely on preparing for a rapid evacuation without initiating any on-site rewarming efforts. Option D. Assess the patient's pupils and administer a mild stimulant to improve alertness. The correct answer is A. Immediately begin active rewarming measures using available insulating materials and provide warm, sweet fluids if the patient is conscious and able to swallow. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a wilderness medicine provider to balance immediate patient needs with the limitations and specific protocols dictated by the FAWM framework, which emphasizes evidence-based practice and appropriate scope of care in remote environments. The provider must consider the potential for delayed evacuation and the need for interventions that are sustainable and safe given the wilderness setting. Correct approach analysis. The correct approach aligns with FAWM principles by prioritizing a systematic assessment and management strategy that is appropriate for a wilderness environment. This involves recognizing the limitations of the setting, utilizing available resources judiciously, and making decisions based on established wilderness first aid protocols. The FAWM framework emphasizes the importance of understanding the patient's condition in the context of the environment, including factors like temperature, terrain, and potential for further injury or illness. This approach ensures that interventions are not only effective, but also safe and sustainable until definitive care can be reached. Incorrect approaches analysis. One incorrect approach would be to immediately attempt advanced interventions that are typically performed in a hospital setting, without considering the provider's scope of practice in a wilderness context or the feasibility of such interventions in a remote location. This violates FAWM guidelines by potentially exceeding the provider's training and by introducing risks associated with performing complex procedures without adequate support or monitoring. It also fails to acknowledge the primary goal of wilderness medicine: stabilization and safe evacuation. Another incorrect approach would be to solely rely on the patient's subjective report of pain without conducting a thorough, objective assessment. FAWM protocols stress the importance of a comprehensive physical examination to identify underlying pathology and guide treatment. Ignoring objective findings in favor of subjective complaints can lead to misdiagnosis and inappropriate management, potentially worsening the patient's condition. A third incorrect approach would be to delay evacuation unnecessarily, even when the patient's condition suggests a need for higher-level care. FAWM guidelines emphasize timely evacuation when indicated. Prolonging care in the wilderness beyond what is safely manageable can lead to decompensation and poorer outcomes, representing a failure to adhere to best practices for patient safety in remote settings. Professional reasoning. Professionals should employ a structured decision-making process that begins with scene safety and primary survey, followed by a detailed secondary survey. This assessment should inform the application of wilderness-specific interventions, always considering the patient's condition, the environmental factors, and the available resources. The decision to evacuate and the urgency of that evacuation should be continuously re-evaluated based on the patient's response to treatment and the evolving situation. Adherence to FAWM principles ensures that care is both effective and ethically sound within the unique constraints of wilderness medicine. Question 3. The risk matrix shows a high probability of medical emergencies and a low probability of timely external evacuation for a remote research outpost. Considering the fellowship in the Academy of Wilderness Medicine, FAWM framework, which implementation strategy best addresses the long-term medical needs of the outpost and its personnel in this austere environment? Option A. Equip the outpost with state-of-the-art diagnostic equipment and advanced treatment modalities, assuming that external medical evacuation will be utilized for all but the most minor issues. Option B. Develop a comprehensive, locally managed medical program that includes training local personnel, establishing a well-stocked clinic with appropriate supplies for common wilderness injuries and illnesses, and implementing robust preventative health measures. Option C. Focus solely on establishing a rapid response protocol for critical emergencies, including advanced communication systems for immediate medical advice, but without significant investment in local medical infrastructure or personnel development. Option D. Schedule regular, biannual visits from specialized wilderness medical teams to provide advanced care and conduct training, while relying on the outpost's basic first aid kits for day-to-day needs. The correct answer is B. Develop a comprehensive, locally managed medical program that includes training local personnel, establishing a well-stocked clinic with appropriate supplies for common wilderness injuries and illnesses, and implementing robust preventative health measures. Explanation. Scenario analysis. This scenario presents a significant implementation challenge because it requires balancing immediate medical needs with long-term sustainability and ethical considerations in a resource-limited, remote environment. The inherent unpredictability of wilderness medicine, coupled with the potential for delayed evacuation and limited access to advanced medical facilities, necessitates a proactive and adaptable approach. The FAWM framework emphasizes preparedness, appropriate resource allocation, and the ability to manage medical emergencies with the tools and personnel available. Correct approach analysis. The correct approach prioritizes establishing a robust, locally sustainable medical support system. This aligns with FAWM principles by focusing on building capacity within the remote community, ensuring that medical care can be provided effectively and consistently, even when external support is unavailable or delayed. It addresses the remote and austere aspect by empowering local individuals and integrating with existing community structures, thereby enhancing resilience and reducing reliance on external, potentially inaccessible, resources. This approach is ethically sound as it promotes self-sufficiency and equitable access to care within the affected population. Incorrect approaches analysis. One incorrect approach might involve solely relying on periodic external medical missions. This fails to address the continuous nature of medical needs in a remote environment and creates a dependency that is vulnerable to logistical disruptions, funding fluctuations, and the inherent challenges of accessing remote locations. Ethically, this approach can lead to a false sense of security and may not provide consistent care, potentially violating principles of beneficence and justice by offering intermittent, rather than sustained, support. It also neglects the FAWM emphasis on developing local expertise. Another incorrect approach could be to implement highly advanced but unsustainable medical technologies without considering local infrastructure, training, or maintenance capabilities. This is a direct contravention of the FAWM focus on practical, appropriate wilderness medicine. Such an approach would be wasteful, likely to fail due to lack of local support, and could create ethical dilemmas if patients become dependent on technology that cannot be maintained. It ignores the core tenet of wilderness medicine, adapting care to the environment. A third incorrect approach might be to focus exclusively on emergency response, without investing in preventative care or basic health education. While emergency preparedness is crucial in wilderness medicine, neglecting the foundational aspects of health can lead to a higher incidence of preventable conditions, overwhelming the limited resources available. This is an incomplete application of wilderness medicine principles, which advocate for a holistic approach to health and well-being in challenging environments. Professional reasoning. Professionals faced with this challenge should employ a systematic decision-making process that begins with a thorough needs assessment of the remote environment, considering the specific risks and vulnerabilities. This should be followed by an evaluation of available resources, both internal and external, and an assessment of the local capacity for healthcare delivery. The FAWM framework guides the development of a tiered response system, prioritizing sustainable solutions that build local resilience and incorporate preventative measures alongside emergency preparedness. Ethical considerations, including equity, beneficence, and non-maleficence, must be integrated into every stage of planning and implementation. Question 4. The risk matrix shows a wilderness expedition leader encountering a 55-year-old male participant who suddenly collapses, exhibiting chest pain radiating to his left arm, shortness of breath, and diaphoresis. The expedition is several hours from the nearest road access. Considering the FAWM curriculum's focus on wilderness cardiac emergencies, which of the following initial management strategies best reflects best professional practice in this scenario? Option A. Attempt to administer a broad-spectrum antibiotic to address potential underlying infection contributing to the symptoms, and then reassess in 30 minutes. Option B. Encourage the patient to rest and drink water, assuming the symptoms are likely due to dehydration or exertion, and postpone any active medical intervention until symptoms worsen significantly. Option C. Wait for the arrival of advanced medical personnel before initiating any pharmacological interventions, focusing solely on basic life support and comfort measures. Option D. Administer aspirin and sublingual nitroglycerin if available and not contraindicated. Initiate high-flow oxygen if available, and prepare for immediate evacuation while continuously monitoring vital signs. The correct answer is D. Administer aspirin and sublingual nitroglycerin if available and not contraindicated. Initiate high-flow oxygen if available, and prepare for immediate evacuation while continuously monitoring vital signs. Explanation. The risk matrix shows a scenario involving a wilderness expedition facing a sudden cardiac emergency in a remote setting. This situation is professionally challenging due to the inherent limitations of wilderness environments, delayed access to advanced medical care, limited diagnostic tools, and the need for the expedition leader to make critical decisions with potentially incomplete information. The leader must balance immediate patient needs with the safety and logistical realities of the expedition. The correct approach emphasizes immediate, evidence-based interventions for suspected cardiac emergencies, prioritizing patient stabilization and timely evacuation. This aligns with wilderness medicine best practices, which advocate for a proactive and decisive management strategy in resource-limited settings. Specifically, it reflects the FAWM curriculum's emphasis on recognizing and managing life-threatening conditions promptly, even with limited resources. This approach is ethically sound, adhering to the principle of beneficence by acting in the patient's best interest and minimizing harm. It also aligns with professional guidelines that stress the importance of rapid assessment, appropriate pharmacological and non-pharmacological interventions, and efficient communication for evacuation. An incorrect approach that delays definitive care or relies solely on awaiting advanced medical personnel without initiating critical interventions would be professionally unacceptable. Such a delay could constitute a breach of the duty of care, potentially leading to worsened patient outcomes and violating ethical principles of non-maleficence, avoiding harm. Furthermore, failing to utilize available resources or knowledge to initiate appropriate management could be seen as a failure to meet professional standards of competence expected of a wilderness medicine provider. Another incorrect approach might involve over-reliance on unproven or non-standard treatments, which would lack evidence-based support and could introduce unnecessary risks, failing to uphold the principle of evidence-based practice and potentially causing harm. Professional decision-making in such situations requires a systematic approach, rapid scene assessment for safety, immediate ABC airway, breathing, circulation assessment, prompt recognition of cardiac emergency signs and symptoms, initiation of appropriate interventions based on available equipment and training, clear and concise communication with external medical support for evacuation planning, and continuous reassessment of the patient's condition. This framework prioritizes patient safety and optimal outcomes within the constraints of the wilderness environment. Question 5. Consider a scenario where a hiker sustains a suspected midshaft tibia fracture during a fall in a remote mountain range, with significant pain and deformity. The evacuation route is estimated to be 12 hours away by foot, and the weather is deteriorating. The wilderness first responder has a limited medical kit. Which of the following approaches best balances immediate patient care with the principles of wilderness medicine for this suspected fracture? Option A. Attempt to reduce the deformity to align the bone ends before splinting, as this will reduce pain and improve circulation. Option B. Administer strong analgesics and wait for advanced medical personnel to arrive before attempting any splinting or manipulation. Option C. Apply a rigid splint that extends from above the knee to below the ankle, ensuring immobilization of both the knee and ankle joints, and reassess distal pulses and sensation. Option D. Immobilize only the fractured segment of the tibia with padding and bandages, as the primary goal is to prevent gross movement. The correct answer is A. Attempt to reduce the deformity to align the bone ends before splinting, as this will reduce pain and improve circulation. Explanation. This scenario presents a professional challenge due to the inherent risks associated with wilderness medicine, specifically the potential for exacerbating an injury or causing further harm when definitive care is remote. The wilderness environment demands a high degree of self-reliance, resourcefulness, and adherence to established protocols, as immediate access to advanced medical facilities is not available. The decision-making process for splinting must prioritize patient safety, pain management, and the prevention of secondary complications. The correct approach represents best professional practice by adhering to the principles of wilderness medicine and the established guidelines for fracture and dislocation management. This involves a thorough assessment of the injury, appropriate reduction techniques if indicated and within the provider's scope of practice, and the application of a splint that immobilizes the affected joint above and below the injury site. This method minimizes further tissue damage, reduces pain by preventing movement of fractured ends, and prepares the patient for safe evacuation. The FAWM curriculum emphasizes evidence-based practices and the ethical responsibility to provide care that is both effective and safe in remote settings, aligning with the principle of do no harm. An incorrect approach that involves aggressive manipulation without proper assessment or training would be a significant ethical and professional failure. This could lead to neurovascular compromise, increased pain, conversion of a closed fracture to an open one, or damage to surrounding soft tissues. Such actions violate the ethical duty to act within one's competence and to prioritize patient well-being. Another incorrect approach, such as splinting only the injured limb without considering proximal and distal joint immobilization, fails to provide adequate stability, potentially leading to continued movement, increased pain, and delayed healing. This demonstrates a lack of understanding of biomechanical principles essential for effective splinting and could be considered a breach of professional standards of care. Professionals in wilderness settings should employ a systematic decision-making process. 1. Scene safety and initial patient assessment. 2. Injury assessment, including checking for pulses, sensation, and motor function distal to the injury. 3. Determining if reduction is necessary and within the provider's skill set and the patient's tolerance. 4. Selecting and applying an appropriate splint that immobilizes the joint above and below the injury. 5. Reassessing distal neurovascular status after splinting. 6. Planning for evacuation and ongoing monitoring. This structured approach ensures that interventions are appropriate, safe, and contribute to the best possible outcome for the patient in a challenging environment. Question 6. The investigation demonstrates a wilderness medicine provider responding to a patient experiencing acute respiratory distress and altered mental status following a fall in a remote alpine environment. The provider has limited communication capabilities and is several hours from the nearest road access. The patient has a known history of asthma but is not carrying their usual inhaler. The provider has a standard wilderness medical kit. Which of the following actions best reflects the appropriate initial management and decision-making process in this wilderness medical emergency? Option A. Attempt to improvise an airway adjunct and administer a broad-spectrum antibiotic, anticipating potential aspiration pneumonia. Option B. Focus solely on providing comfort measures and await the arrival of a search and rescue team, as definitive airway management is not possible. Option C. Prioritize immediate administration of a high-dose corticosteroid and bronchodilator, then wait for further patient deterioration before considering evacuation. Option D. Administer supplemental oxygen, initiate a rapid but controlled descent with the patient, and attempt to establish communication for evacuation. The correct answer is D. Administer supplemental oxygen, initiate a rapid but controlled descent with the patient, and attempt to establish communication for evacuation. Explanation. The investigation demonstrates a scenario where a wilderness medicine provider faces a critical medical emergency in a remote setting, necessitating immediate and effective intervention while adhering to established wilderness medicine protocols and ethical considerations. The professional challenge lies in the inherent limitations of a wilderness environment: delayed access to definitive care, limited resources, and the need for autonomous decision-making under pressure. Careful judgment is required to balance the urgency of the medical situation with the safety of the patient and the provider, as well as the logistical realities of the environment. The correct approach represents best professional practice because it prioritizes patient safety and well-being through evidence-based wilderness medical protocols. This involves a systematic assessment, appropriate stabilization, and a well-considered plan for evacuation or continued care, all within the scope of practice for a wilderness medicine provider. Adherence to these protocols ensures that decisions are not arbitrary, but are grounded in established medical knowledge and ethical principles relevant to wilderness medicine, such as the duty of care and the principle of beneficence. An incorrect approach that involves delaying definitive treatment due to an overestimation of the patient's ability to self-recover, without a clear rationale based on ongoing assessment and prognosis, represents a failure to act in the patient's best interest. This could be considered a breach of the duty of care, as it deviates from the expected standard of practice in wilderness medicine, which emphasizes proactive management of potentially deteriorating conditions. Another incorrect approach, such as initiating an immediate high-risk evacuation without a thorough assessment of the patient's stability and the feasibility of the evacuation route, could violate the principle of non-maleficence. This approach might expose the patient to unnecessary risks without a clear medical imperative, failing to adequately weigh the potential harms against the benefits. A further incorrect approach, such as administering unproven or experimental treatments without proper justification or informed consent, where feasible, would represent a significant ethical and regulatory failure. This disregards established medical guidelines and the ethical requirement for evidence-based practice and patient autonomy. The professional decision-making process for similar situations should involve a rapid but thorough patient assessment, including a focused history and physical examination. This should be followed by a differential diagnosis and risk stratification. Based on this assessment, the provider must formulate a treatment plan that includes immediate interventions, ongoing monitoring, and a clear evacuation strategy, considering factors such as patient stability, environmental conditions, available resources, and the time to definitive care. Continuous reassessment is crucial to adapt the plan as the situation evolves. Question 7. Upon reviewing a wilderness patient with a suspected lower extremity fracture sustained during a multi-day backpacking trip in a remote mountainous region, and considering the approaching inclement weather and limited daylight, which of the following risk assessment and management approaches best aligns with responsible wilderness medicine practice? Option A. Delay any evacuation attempts until the weather clears and daylight is optimal, focusing solely on providing comfort care to the patient in situ. Option B. Conduct a thorough risk assessment, evaluating environmental hazards, patient condition, available resources, and potential evacuation methods before formulating a management and evacuation plan. Option C. Immediately initiate a ground evacuation, prioritizing speed over a detailed assessment of environmental hazards and the patient's stability. Given the urgency of the weather, Option D. Proceed with a hasty evacuation using the quickest available method, assuming the patient can tolerate the stress of rapid transport without further medical evaluation. The correct answer is C. Immediately initiate a ground evacuation, prioritizing speed over a detailed assessment of environmental hazards and the patient's stability, given the urgency of the weather. Explanation. This scenario presents a professionally challenging situation because it requires a wilderness medicine provider to balance the immediate need for patient care with the inherent risks of the environment and the limitations of available resources. The decision-making process is complicated by the dynamic nature of wilderness environments, the potential for rapid deterioration of a patient's condition, and the ethical imperative to act while also ensuring the safety of the rescue team. Careful judgment is required to assess the severity of the injury, the feasibility of different evacuation methods, and the potential consequences of each course of action. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based risk assessment that directly informs the management plan. This aligns with the core principles of wilderness medicine, which emphasize preparedness, risk mitigation, and patient advocacy within the context of the unique challenges of remote environments. Specifically, it adheres to the implicit guidelines of responsible wilderness medicine practice, which advocate for a thorough evaluation of environmental hazards, patient condition, and resource availability before committing to a course of action. This approach ensures that decisions are not made impulsively, but are grounded in a comprehensive understanding of the situation, thereby maximizing patient safety and the likelihood of a successful outcome while minimizing risks to rescuers. An incorrect approach that fails to conduct a thorough risk assessment before initiating evacuation would be professionally unacceptable. This failure represents a direct contravention of the ethical obligation to act with due care and diligence. It could lead to an escalation of risks, such as exposing the patient and rescuers to further environmental hazards, or attempting an evacuation that is beyond the capabilities of the team or the patient's condition, potentially resulting in iatrogenic harm. Another incorrect approach, such as delaying evacuation indefinitely due to an overestimation of risks without a clear plan for mitigation, would also be professionally deficient. This failure to act when appropriate care is possible could violate the duty to provide timely medical intervention, potentially leading to a worse patient outcome. The professional decision-making process for similar situations should involve a structured approach. 1. Scene safety and hazard assessment. Environmental. Patient-related. 2. Patient assessment, primary and secondary surveys, vital signs, mechanism of injury. 3. Identification of potential management options and their associated risks and benefits. 4. Resource evaluation, personnel, equipment, time, communication. 5. Decision-making based on the comprehensive assessment, prioritizing patient well-being and rescuer safety. 6. Implementation of the chosen plan with ongoing reassessment and adaptation as needed. Question 8. The control framework reveals a group of hikers experiencing symptoms consistent with moderate dehydration after a strenuous day in a hot, arid environment. One individual, a 45-year-old male with a history of mild hypertension, is exhibiting dry mucous membranes, decreased skin turgor, and is reporting significant thirst and fatigue. The group has limited access to potable water and no immediate means of evacuation. Considering the principles of wilderness medicine and the potential for complications, which of the following strategies best addresses the immediate management of this individual's dehydration while mitigating associated risks? Option A. Delay significant fluid intervention until the individual exhibits more severe signs of dehydration, such as confusion or a rapid pulse, to avoid overhydration. Option B. Advise the individual to rest and drink plain water as much as possible, assuming that thirst will adequately guide fluid intake. Option C. Immediately initiate intravenous fluid resuscitation with a large volume of hypotonic saline to rapidly restore fluid balance. Option D. Administer oral rehydration solutions containing electrolytes at a moderate pace, encouraging continued small sips, and closely monitor for improvement in symptoms and urine output. The correct answer is D. Administer oral rehydration solutions containing electrolytes at a moderate pace, encouraging continued small sips, and closely monitor for improvement in symptoms and urine output. Explanation. This scenario presents a professionally challenging situation due to the inherent uncertainty in assessing dehydration in a remote wilderness setting, compounded by the need to balance aggressive fluid replacement with the risk of hyponatremia. The FAWM curriculum emphasizes a risk-based approach to patient care, prioritizing safety and evidence-based practice within the constraints of wilderness medicine. Careful judgment is required to interpret subtle clinical signs and patient history to guide fluid management effectively. The correct approach represents best professional practice by prioritizing a gradual, monitored rehydration strategy tailored to the individual's clinical presentation and environmental factors. This aligns with FAWM principles of patient assessment, risk stratification, and appropriate intervention. It acknowledges that while dehydration is a significant risk, overzealous fluid administration without adequate electrolyte monitoring can lead to more severe complications, particularly in prolonged or extreme environments. This approach is ethically sound as it seeks to minimize harm and maximize benefit, adhering to the principle of non-maleficence. An incorrect approach that focuses solely on rapid, high-volume fluid administration without considering electrolyte balance or the patient's ability to excrete excess fluid would be professionally unacceptable. This could lead to hyponatremia, a potentially life-threatening condition, especially in a wilderness setting where advanced medical interventions are limited. Such an approach would fail to meet the standard of care expected in wilderness medicine, which demands a nuanced understanding of physiological responses to stress and environmental challenges. Ethically, it would represent a failure to adequately assess risk and implement a safe, evidence-based treatment plan. Another incorrect approach might involve delaying significant fluid intervention based on mild symptoms, potentially allowing dehydration to progress to a more critical state. This would be a failure to recognize and act upon early warning signs, thereby increasing patient morbidity. It would contravene the ethical obligation to provide timely and appropriate care. The professional decision-making process for similar situations should involve a systematic assessment of the patient's hydration status, considering factors such as activity level, environmental conditions, heat, humidity, altitude, fluid intake, urine output and color, and subjective symptoms. This assessment should then inform a tiered approach to fluid replacement, starting with oral rehydration if possible, and progressing to intravenous fluids if necessary, with careful consideration of electrolyte content and rate of administration. Continuous reassessment of the patient's response is crucial to adjust the treatment plan and prevent complications. Question 9. Examination of the data shows a 35-year-old individual experiencing headache, nausea, and fatigue after ascending to 12,000 feet over 2 days. They report mild dizziness and a general feeling of malaise. There's no shortness of breath at rest, cough, or neurological deficits noted on initial assessment. The group is 2 days hike from the nearest road access. Considering the principles of risk assessment in wilderness medicine, which of the following represents the most appropriate initial management strategy? Option A. Provide oral rehydration and encourage rest, assuming symptoms will resolve with acclimatization. Option B. Administer acetazolamide and monitor symptoms closely, advising continued ascent if symptoms do not worsen. Option C. Recommend immediate descent of at least 1,000-2,000 feet and provide symptomatic treatment for nausea and headache. Option D. Initiate immediate evacuation to the nearest medical facility due to the potential for serious altitude illness. The correct answer is B. Administer acetazolamide and monitor symptoms closely, advising continued ascent if symptoms do not worsen. Explanation. This scenario presents a common challenge in wilderness medicine, managing a patient experiencing symptoms of acute mountain sickness, AMS, in a remote setting where immediate evacuation is not feasible. The professional challenge lies in accurately assessing the severity of the AMS, differentiating it from more life-threatening conditions like high-altitude cerebral edema (HACE) or high-altitude pulmonary edema (HAPE), and implementing appropriate management strategies within the limitations of available resources and the FAWM scope of practice. Careful judgment is required to balance the risks of delaying definitive care against the risks of unnecessary intervention or misdiagnosis. The correct approach represents best professional practice by prioritizing a systematic and evidence-based risk assessment. This involves a thorough history, physical examination, and a structured evaluation of symptoms and signs consistent with AMS, HACE, and HAPE. The decision to descend is a critical intervention for moderate to severe AMS and is a cornerstone of safe altitude management, aligning with established wilderness medicine protocols and the ethical imperative to prevent harm. This approach is supported by the principles of patient safety and the FAWM emphasis on evidence-based practice in remote environments. An incorrect approach that involves solely administering symptomatic treatment without a thorough assessment of severity or considering descent fails to adequately address the potential for progression to more severe forms of altitude illness. This could be considered a failure to meet the standard of care expected in wilderness medicine, potentially violating ethical obligations to the patient by not acting decisively to prevent serious harm. Another incorrect approach, such as immediate, unindicated evacuation for mild symptoms, expends valuable resources and may unnecessarily expose the patient to further risks associated with rapid descent or prolonged transport, demonstrating a lack of nuanced risk-benefit analysis. A third incorrect approach, relying solely on anecdotal experience without applying structured diagnostic criteria, introduces a significant risk of misdiagnosis and inappropriate management, deviating from the professional responsibility to utilize validated assessment tools. The professional decision-making process for similar situations should involve a structured approach. 1. Initial assessment. Rapidly gather vital signs and chief complaint. 2. Differential diagnosis. Consider common altitude illnesses, AMS, HACE, HAPE, and other potential causes of symptoms. 3. Symptom and sign evaluation. Utilize validated tools like the Lake Louise score for AMS. 4. Risk stratification. Determine the severity of illness and the likelihood of progression. 5. Intervention planning. Based on risk stratification, decide on appropriate management, including descent, medication, or evacuation. 6. Reassessment. Continuously monitor the patient's response to interventions. This systematic process ensures that decisions are grounded in evidence and patient safety, aligning with the ethical and professional standards of wilderness medicine. Question 10. Performance analysis shows that a volunteer rescuer, certified by FAWM and operating under a U.S.-based SAR organization, encounters a critically injured individual in a remote wilderness setting. The rescuer recognizes a life-threatening condition that could be stabilized with an advanced medical procedure, but this procedure falls slightly outside their current specific training certification. Though it is within the broader skill set of their SAR team, the rescuer has direct radio communication with their incident command. What is the most appropriate course of action? Option A. Contact incident command to report the situation, the patient's condition, and their assessment of the need for the advanced procedure, requesting guidance and potentially specialized assistance. Option B. Decide not to intervene with the advanced procedure. as it is outside their personal certification, and wait for higher-level medical support to arrive, even if it means significant delay. Option C. Perform a less advanced intervention that is within their direct certification, even if it is suboptimal for the patient's critical condition. Option D. Immediately attempt the advanced procedure, believing the patient's life is at stake and that their team possesses the overall capability. The correct answer is D. Immediately attempt the advanced procedure, believing the patient's life is at stake and that their team possesses the overall capability. Explanation. Scenario analysis. This scenario presents a common challenge in wilderness search and rescue (SAR) operations where a rescuer, acting as a volunteer for a FAWM-certified organization, encounters a situation requiring a potentially life-saving intervention that falls outside their immediate training scope, but is within the broader capabilities of their team. The professional challenge lies in balancing the urgency of the situation, the rescuer's individual limitations, the potential for harm, and the ethical imperative to act when possible, all while adhering to the established protocols and legal frameworks governing volunteer SAR operations in the United States. The rescuer must consider their duty of care, the principles of wilderness medicine, and the potential legal ramifications of both action and inaction. Correct approach analysis. The correct approach emphasizes communication and adherence to established protocols, which is the cornerstone of best professional practice in U.S.-based volunteer SAR. This involves immediately notifying the incident commander or designated medical lead about the situation and the rescuer's assessment. This allows for a coordinated response, ensuring that the most appropriate resources and personnel are deployed. It upholds the ethical principle of beneficence by seeking to provide the best possible care while mitigating risk. Legally, it aligns with the principles of agency and scope of practice within a volunteer organization, protecting both the individual rescuer and the organization by ensuring decisions are made at the appropriate command level and by qualified individuals. This approach respects the established chain of command and the legal framework that governs volunteer emergency services, which often relies on clear communication and defined roles to ensure accountability and effective resource management. Incorrect approaches analysis. One incorrect approach involves the rescuer attempting the advanced procedure without consulting their command structure. This constitutes a failure to adhere to established operational protocols and the chain of command, which are critical for maintaining order and safety in SAR operations. Ethically, it bypasses the principle of seeking appropriate consultation and potentially exposes the patient to undue risk if the rescuer's skills are not truly adequate or if the procedure is contraindicated in the specific wilderness context. Legally, this could be viewed as exceeding one's authority or acting outside the scope of their volunteer role, potentially leading to liability for the rescuer and the organization. Another incorrect approach is to do nothing because the rescuer feels unqualified, even though the situation is dire and the patient's life is at immediate risk. While caution is important, a complete failure to act when there is a clear and present danger, and when consultation might have led to a viable solution, could be ethically problematic. It may violate the implicit duty of care that volunteer rescuers undertake. Legally, while inaction is generally less risky than negligent action, a complete dereliction of duty in a life-threatening situation, especially when other options might have been explored through proper channels, could be scrutinized. A third incorrect approach is to administer a treatment that is clearly outside the rescuer's training and certification, even if they believe it is for the patient's benefit. This is a direct violation of the principle of practicing within one's scope of practice, a fundamental ethical and legal requirement for all medical providers, including wilderness responders. This action prioritizes the rescuer's subjective judgment over established professional standards and could lead to significant harm to the patient, resulting in severe legal and ethical repercussions. Professional reasoning. In wilderness SAR, decision-making should follow a structured process. First, assess the situation and the patient's needs. Second, identify personal capabilities and limitations. Third, consult established protocols and the incident command structure. Fourth, communicate clearly and concisely with the appropriate authorities. Fifth, act decisively based on the guidance received and within one's validated scope of practice. This systematic approach ensures patient safety, operational efficiency, and legal and ethical compliance. Question 11. Market research demonstrates that wilderness medical providers frequently encounter situations where rapid neurological assessment and intervention are critical. Considering a scenario where a patient in a remote backcountry setting presents with sudden onset of unilateral weakness, slurred speech, and visual disturbances, what is the most appropriate initial management strategy? Option A. Administer broad-spectrum anticonvulsant medication to manage potential seizure activity and monitor vital signs closely. Option B. Initiate immediate evacuation to the nearest definitive care facility while providing supportive care en route. Option C. Provide symptomatic relief for headache and nausea, and advise the patient to rest and hydrate before reassessing in several hours. Option D. Attempt to perform a comprehensive battery of neurological tests, using available field equipment to definitively diagnose the cause before considering evacuation. The correct answer is B. Initiate immediate evacuation to the nearest definitive care facility while providing supportive care en route. Explanation. Scenario analysis. This scenario is professionally challenging due to the remote and austere environment, which limits immediate access to advanced medical facilities and diagnostic tools. The wilderness medicine provider must make critical decisions regarding neurological emergencies with limited resources, potentially impacting patient outcomes significantly. The urgency of stroke and seizure management, coupled with the inherent risks of wilderness travel, necessitates a rapid and accurate assessment and intervention strategy. Correct approach analysis. The correct approach prioritizes rapid assessment of neurological deficits, immediate stabilization of the patient, and prompt evacuation to definitive care. This aligns with wilderness medicine best practices, which emphasize recognizing life-threatening conditions, providing appropriate field interventions, and facilitating timely transport. The FAWM curriculum stresses the importance of understanding the time-sensitive nature of neurological emergencies and the need for swift action to minimize secondary brain injury and improve prognosis. This approach is ethically sound as it upholds the duty of care to the patient by seeking the highest level of medical attention as quickly as possible. Incorrect approach is analysis. One incorrect approach involves delaying evacuation to conduct extensive, resource-intensive diagnostic tests that are not feasible or appropriate in a wilderness setting. This fails to acknowledge the limitations of field medicine and the critical time window for effective stroke treatment. Ethically, this approach could be considered negligent, as it prioritizes non-essential procedures over timely transport to definitive care, potentially leading to irreversible neurological damage. Another incorrect approach is to administer treatments without a clear understanding of the underlying cause, or without considering potential contraindications in a wilderness context. For example, aggressive seizure suppression without considering the patient's overall condition or the potential for adverse drug interactions in a remote setting could be harmful. This violates the principle of do no harm and demonstrates a lack of sound clinical judgment, potentially leading to iatrogenic complications. A third incorrect approach is to assume a less serious cause for the neurological symptoms and opt for conservative management without arranging for evacuation. This overlooks the potential for serious underlying pathology like stroke or a complex seizure disorder. This failure to recognize and act upon a potentially life-threatening condition constitutes a significant ethical lapse and a breach of professional responsibility. Professional reasoning. Wilderness medicine professionals must employ a systematic approach to neurological emergencies. This involves 1. Rapidly assessing the patient's airway, breathing, and circulation ABCs, followed by a focused neurological exam to identify focal deficits or signs of seizure activity. 2. Stabilizing the patient, managing airway if compromised, and ensuring adequate oxygenation. 3. Recognizing the urgency of the situation and initiating plans for rapid evacuation to the nearest appropriate medical facility. 4. Considering field interventions that are safe and evidence-based, such as glucose monitoring for altered mental status, and seizure management if indicated and within the provider's scope of practice. 5. Communicating effectively with dispatch and receiving medical facilities to facilitate a smooth handover of care. This decision-making process is guided by principles of patient safety, resource optimization, and adherence to established wilderness medical protocols. Question 12. Analysis of a wilderness hiker presenting with altered mental status, hot and dry skin, and a core body temperature of 105 degrees F 40, 5 degrees C, after prolonged exertion in extreme heat. Which of the following management strategies best reflects the immediate priorities for this patient? Option A. Focus solely on rapid evacuation to the nearest medical facility, as field interventions for such a severe presentation are unlikely to be effective. Option B. Initiate aggressive external cooling measures, including immersion in cold water if available, and prepare for rapid evacuation to definitive medical care. Option C. Provide intravenous fluids and electrolytes while awaiting further symptom resolution, and then consider a gradual cooling approach. Option D. Administer oral fluids and electrolytes. Encourage rest in a shaded area, and monitor for improvement over the next hour before considering further action. Correct answer is B. Initiate aggressive external cooling measures, including immersion in cold water if available, and prepare for rapid evacuation to definitive medical care. Explanation. This scenario presents a professional challenge due to the rapid progression of heat illness and the potential for severe morbidity or mortality in a wilderness setting where definitive medical care is delayed. The wilderness environment exacerbates the difficulty by limiting access to resources, requiring the provider to rely on their clinical judgment and available equipment. Differentiating between heat exhaustion and heat stroke is critical, as heat stroke is a medical emergency requiring immediate aggressive cooling and advanced medical intervention. The FAWM curriculum emphasizes evidence-based management of environmental emergencies, requiring providers to apply their knowledge in austere conditions. The correct approach represents best professional practice by prioritizing immediate, aggressive cooling measures for suspected heat stroke, which is the most life-threatening condition. This aligns with wilderness medicine guidelines that advocate for rapid intervention to prevent irreversible organ damage. The ethical imperative to act decisively to preserve life and prevent harm is paramount. This approach is supported by the principle of do no harm and the duty of care expected of a wilderness medical provider. An incorrect approach that delays aggressive cooling in suspected heat stroke, perhaps by waiting for further symptom resolution or attempting less aggressive measures, constitutes a failure to meet the standard of care. This could be considered negligence, as it deviates from established best practices for managing a life-threatening condition. Ethically, it represents a failure to act with the urgency required by the patient's condition. Another incorrect approach might involve misdiagnosing heat exhaustion as a less severe condition and treating it with only rest and hydration, while the patient is actually experiencing heat stroke. This diagnostic error, leading to inadequate treatment, would be a significant professional failure, potentially resulting in severe patient harm. It violates the ethical principle of beneficence by failing to provide the necessary treatment. A third incorrect approach could be to evacuate the patient immediately without initiating any cooling measures in the field, even if cooling is feasible. While evacuation is often necessary, delaying essential life-saving interventions like cooling can be detrimental. This approach fails to recognize the immediate threat posed by hypothermia and the potential for rapid deterioration during transport. The professional decision-making process for similar situations should involve a rapid assessment of the patient's core temperature, if possible, mental status, and signs of organ dysfunction. Based on this assessment, a differential diagnosis should be formed, with a strong consideration for heat stroke. The provider must then weigh the risks and benefits of immediate field interventions versus evacuation, prioritizing life-saving measures that can be performed in the wilderness setting. This involves a continuous reassessment of the patient's condition and a proactive approach to managing environmental emergencies. Question 13. Operational review demonstrates that a wilderness SAR team is tasked with locating a missing hiker. The team has received initial reports of the hiker's last known location and a general description of their intended route. Several potential search strategies are being considered by the team leader. Which of the following approaches best reflects the principles of wilderness SAR as emphasized in advanced wilderness medicine training? Option A. Conducting a thorough analysis of the subject's profile, environmental conditions, terrain, and potential behavioral patterns to develop a prioritized search plan that systematically addresses high-probability areas before expanding to lower-probability zones. Option B. Focusing all available resources on a single, narrow canyon where a witness claims to have heard a faint shout, without systematically searching other potential routes or considering alternative scenarios. Option C. Prioritizing rapid deployment of searchers across a wide, uncoordinated grid pattern, with the primary goal of covering as much ground as possible in the shortest amount of time, regardless of specific probability assessments. Option D. Immediately dispatching search teams to the most visually obvious and easily accessible areas near the last known point, based on the assumption that the hiker would likely seek the most direct path to safety. The correct answer is D. Immediately dispatching search teams to the most visually obvious and easily accessible areas near the last known point, based on the assumption that the hiker would likely seek the most direct path to safety. Explanation: this scenario presents a professionally challenging situation due to the inherent uncertainties and time-critical nature of wilderness search and rescue (SAR) operations. The decision-making process must balance the urgency of locating a missing person with the need for systematic, evidence-based approaches to maximize the probability of success while minimizing risk to rescuers and the subject. The FAWM curriculum emphasizes a structured, multifaceted approach to SAR, grounded in established principles and best practices, rather than ad hoc or solely intuition-driven methods. The correct approach represents best professional practice because it aligns with the core tenets of wilderness SAR as taught within the FAWM framework. This involves a systematic assessment of the situation, including the subject's profile, environmental factors, and available resources, followed by the implementation of a phased search strategy. This strategy prioritizes high-probability areas based on logical deduction and evidence, employs appropriate search techniques, and incorporates ongoing reassessment and adaptation. This methodical process is ethically sound, as it aims to efficiently and effectively locate the subject, thereby fulfilling the duty of care. It also adheres to the implicit regulatory expectation of competent and responsible SAR operations, ensuring that resources are utilized judiciously and that the safety of all involved is paramount. An incorrect approach that relies solely on immediate, unverified information or personal hunches fails to acknowledge the complexity of SAR and the potential for misdirection. This can lead to inefficient resource allocation, wasted time, and an increased risk of overlooking the subject or placing rescuers in unnecessary danger. Ethically, this approach could be seen as a failure to exercise due diligence and professional competence. Another incorrect approach that focuses exclusively on a single, potentially low-probability search area without considering broader possibilities or systematically ruling out other areas demonstrates a lack of comprehensive analysis. This can result in a missed opportunity to find the subject if they are located elsewhere, and can lead to a premature termination of the search without adequate justification. This represents a failure to adhere to the principles of thoroughness and systematic investigation expected in SAR. A further incorrect approach that prioritizes speed over systematic investigation, without a clear understanding of the terrain or potential subject behavior, can lead to a chaotic and ineffective search. This can result in rescuers working at cross purposes, missing critical clues, and potentially creating new hazards. This approach neglects the fundamental principle of organized and coordinated SAR operations. The professional decision-making process for similar situations should involve 1. A thorough initial assessment of all available information. 2. The development of a clear search plan based on probability and logic. 3. The systematic execution of the plan with ongoing communication and coordination. 4. Continuous reassessment of the situation and adaptation of the plan as new information emerges. And 5. A commitment to the safety of all participants. This iterative process ensures that the search remains focused, efficient, and effective. Question 14. The assessment process reveals a group of hikers in a remote alpine environment experiencing an outbreak of acute diarrhea. One individual presents with significant signs of dehydration, including dry mucous membranes, decreased skin turgor, and a rapid pulse. The group has limited supplies, and evacuation is estimated to be 24 hours away. Considering the fellowship in the Academy of Wilderness Medicine, FAWM, curriculum and its emphasis on evidence-based wilderness medical practice, which of the following management strategies best reflects appropriate professional judgment in this scenario? Option A. Encourage the patient to drink plain water as much as possible and avoid any medications until a definitive diagnosis can be made by a physician. Option B. Administer oral rehydration solution ORS aggressively, monitor vital signs closely, and consider empirical treatment for common bacterial pathogens if symptoms persist or worsen. Option C. Administer intravenous fluids immediately, even with limited sterile supplies, to rapidly correct dehydration. Option D. Focus solely on symptom management with antidiarrheal medications and wait for evacuation to initiate fluid resuscitation. The correct answer is B. Administer oral rehydration solution, ORS, aggressively, monitor vital signs closely, and consider empirical treatment for common bacterial pathogens if symptoms persist or worsen. Explanation. The assessment process reveals a scenario where a wilderness medicine provider must manage a patient experiencing severe diarrhea and dehydration in a remote setting. This situation is professionally challenging due to the inherent limitations of wilderness environments, including delayed access to definitive medical care, limited diagnostic tools, and the need for self-sufficiency. The provider must make critical decisions regarding fluid resuscitation, electrolyte management, and potential etiologies of the gastrointestinal distress, all while considering the patient's overall condition and the risks associated with various interventions. The FAWM curriculum emphasizes evidence-based practice and ethical considerations within the context of wilderness medicine. The correct approach represents best professional practice by prioritizing immediate, life-sustaining interventions based on clinical assessment and available resources, aligning with established wilderness medicine guidelines and ethical principles. This involves a systematic evaluation of the patient's hydration status, judicious administration of oral or intravenous fluids, and consideration of empirical treatments for common causes of travelers' diarrhea or infectious gastroenteritis, while continuously monitoring for signs of improvement or deterioration. The FAWM framework stresses the importance of a thorough patient assessment, understanding the physiological impact of dehydration, and applying knowledge of appropriate wilderness medical interventions. Incorrect approaches fail to meet professional standards due to several regulatory and ethical failures. One incorrect approach might involve delaying significant fluid resuscitation due to uncertainty about the exact cause of the diarrhea, which violates the ethical duty to act in the patient's best interest and the regulatory expectation of providing timely and appropriate care within the scope of practice. Another incorrect approach could be the administration of potent medications without a clear indication or consideration of potential side effects in a dehydrated patient, which contravenes the principle of do no harm and the regulatory requirement for evidence-based prescribing. A third incorrect approach might be to solely rely on a patient's subjective report of symptoms without objective assessment of vital signs and hydration status, which demonstrates a failure to adhere to professional standards of care and the regulatory mandate for thorough patient evaluation. Professionals should employ a decision-making framework that begins with a rapid assessment of the patient's airway, breathing, and circulation, ABCs, followed by a detailed history and physical examination focused on identifying the severity of dehydration and potential causes of gastrointestinal distress. This framework should incorporate the principles of wilderness medicine, including risk assessment, resource management, and communication with higher levels of care when possible. The provider must then weigh the risks and benefits of various treatment options, prioritizing interventions that are most likely to stabilize the patient and prevent further complications, all within the ethical and regulatory boundaries of their practice. Question 15. Research into the potential for tick-borne illnesses in a remote mountainous region reveals a patient presenting with a nonspecific febrile illness, myalgias, and a faint rash. The patient has a history of recent backcountry travel in an area known for tick populations. Considering the limited diagnostic capabilities and the need for timely intervention, which of the following decision-making frameworks best guides the wilderness medicine provider's actions? Option A. Administer a broad-spectrum antibiotic to cover a wide range of potential bacterial infections, without specific consideration for tick-borne pathogens, and monitor for improvement before considering evacuation. Option B. Focus solely on symptomatic relief and hydration, deferring any specific diagnostic considerations or treatments until the patient can be evacuated to a medical facility for comprehensive evaluation. Option C. Initiate empiric treatment for common tick-borne diseases based on regional prevalence and the patient's symptoms, while simultaneously arranging for evacuation to a higher level of care for definitive diagnosis and management. Option D. Prioritize immediate evacuation of the patient to the nearest medical facility without any on-site diagnostic assessment or initial treatment, as the remote setting necessitates rapid transfer for any serious illness. The correct answer is C. Initiate empiric treatment for common tick-borne diseases based on regional prevalence and the patient's symptoms, while simultaneously arranging for evacuation to a higher level of care for definitive diagnosis and management. Explanation: this scenario presents a professionally challenging situation due to the inherent uncertainties of wilderness medicine, the potential for rapid deterioration of a patient's condition, and the limited resources available far from definitive medical care. The decision-making process must balance immediate patient needs with the logistical realities of evacuation and the potential for misdiagnosis or delayed treatment. Careful judgment is required to assess risk, prioritize interventions, and communicate effectively with both the patient and any potential support networks. The correct approach represents best professional practice by prioritizing a systematic, evidence-based diagnostic process that considers the specific risks of the wilderness environment. This aligns with the ethical obligation to provide competent care and the professional standards expected of FAWM practitioners, which implicitly require adherence to established medical guidelines and a commitment to patient safety. The FAWM curriculum emphasizes a thorough understanding of infectious diseases relevant to wilderness settings and the appropriate management strategies, including recognizing when advanced medical intervention is necessary. An incorrect approach that relies solely on anecdotal evidence or personal experience without a structured diagnostic framework is professionally unacceptable. This fails to meet the standard of care and could lead to misdiagnosis, inappropriate treatment, and potentially severe patient harm. Such an approach also disregards the importance of consulting current medical literature and established protocols, which are crucial for informed decision-making in complex medical situations. Another incorrect approach that prioritizes immediate evacuation without a thorough initial assessment is also professionally flawed. While evacuation is often a critical component of wilderness medicine, it should be a reasoned decision based on the patient's condition and the likelihood of benefit from further on-site intervention versus the risks and delays associated with transport. Premature evacuation can lead to unnecessary resource expenditure, patient discomfort, and potentially delay definitive care if the initial assessment was incomplete. A third incorrect approach that involves administering broad-spectrum antibiotics without a clear indication or diagnostic suspicion is ethically questionable and professionally unsound. While antibiotics are vital in treating bacterial infections, their indiscriminate use can contribute to antibiotic resistance and mask underlying conditions, making subsequent diagnosis more difficult. This approach deviates from the principle of judicious antibiotic stewardship. The professional decision-making process for similar situations should involve a structured approach. 1. Scene safety and initial assessment. Ensure the safety of the rescuer and patient, then conduct a rapid primary survey, ABCs. 2. Focused history and physical examination. Gather relevant history, onset, symptoms, exposures, travel, and perform a thorough physical exam looking for signs and symptoms suggestive of specific infectious processes. 3. Differential diagnosis. Develop a list of potential infectious causes based on the patient's presentation, the environment, and potential exposures. 4. Risk assessment. Evaluate the severity of the illness, the patient's stability, and the likelihood of rapid deterioration. 5. Treatment planning. Based on the differential diagnosis and risk assessment, formulate a treatment plan that may include symptomatic management, specific antimicrobial therapy if indicated, and consideration of evacuation. 6. Communication and consultation. Clearly communicate findings and plans to the patient, and if possible, consult with remote medical advisors or emergency services. 7. Reassessment. Continuously reassess the patient's condition and the effectiveness of interventions. Question 16. The evaluation methodology shows that when assessing a wilderness trauma patient who fell from a significant height onto uneven terrain, which of the following approaches best guides the initial assessment and subsequent management decisions? Option A. Prioritizing a detailed analysis of the forces involved in the fall and the terrain's impact characteristics to anticipate potential internal injuries and spinal trauma. Option B. Focusing primarily on the visible external abrasions and lacerations to determine the extent of tissue damage. Option C. Relying on generalized wilderness injury protocols without specific consideration for the unique biomechanical forces of a fall from height. Option D. Assuming the patient's pre-existing medical conditions are the primary drivers of their current presentation without further investigation into the fall's mechanics. The correct answer is A. prioritizing a detailed analysis of the forces involved in the fall and the terrain's impact characteristics to anticipate potential internal injuries and spinal trauma. Explanation: the evaluation methodology shows that understanding the mechanisms of injury in wilderness environments is paramount for effective wilderness medical care, directly impacting patient assessment, treatment, and evacuation decisions. This scenario is professionally challenging because wilderness environments often present unique factors such as remoteness, limited resources, and delayed access to definitive care, which amplify the consequences of misjudging the forces involved in an injury. A wilderness medicine provider must not only recognize the immediate injury, but also anticipate potential secondary complications arising from the mechanism. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of biomechanics and forces applied to the body, aligning with the FAWM emphasis on evidence-based wilderness medicine. This approach allows for a more accurate prediction of internal injuries, even when external signs are minimal, and guides appropriate field interventions and the urgency of evacuation. It reflects a commitment to patient safety and optimal outcomes by considering the full spectrum of potential harm, consistent with the ethical obligation to provide competent care within the scope of wilderness medicine practice. An incorrect approach that focuses solely on visible trauma without considering the underlying forces fails to meet the standard of care expected in wilderness medicine. This oversight can lead to underestimation of injury severity, delayed or inappropriate treatment, and potentially catastrophic outcomes. Ethically, this represents a failure to exercise due diligence and a lack of comprehensive patient assessment, potentially violating principles of beneficence and non-maleficence. Another incorrect approach that relies on assumptions about the patient's pre-existing condition without a thorough mechanism-based assessment can lead to misdiagnosis and ineffective treatment, again failing to uphold professional standards. Relying on anecdotal evidence or generalized wilderness injury patterns without specific mechanism analysis can also be a regulatory and ethical failure, as it deviates from a systematic, evidence-informed approach to patient care. Professional decision-making in such situations requires a systematic process. First, thoroughly gather information about the incident, including the forces involved, e.g., fall height, speed of impact, type of object. Second, apply knowledge of biomechanics to predict potential injuries. Third, conduct a focused physical examination guided by the suspected mechanisms. Fourth, consider the environmental context and resource limitations when planning interventions and evacuation. Finally, continuously reassess the patient's condition, updating the differential diagnosis and treatment plan as needed. This structured approach ensures that all relevant factors are considered, leading to the most appropriate and safest patient management. Question 17. The control framework reveals that the development of standardized wilderness medical protocols and the establishment of formal training programs in the late 20th century were largely driven by a confluence of factors. Which of the following historical developments most significantly influenced the regulatory and ethical underpinnings of modern wilderness medicine practice, as recognized by the FAWM? Option A. The widespread adoption of minimalist expeditionary philosophies that emphasized self-reliance and downplayed the role of formal medical training, leading to a focus on basic first aid rather than comprehensive wilderness medicine. Option B. The development of advanced satellite communication technologies that allowed for real-time medical consultation from remote locations, thereby reducing the need for extensive on-site medical training. Option C. The emergence of early, non-standardized medical kits used by explorers in the early 20th century, which were primarily focused on treating common ailments like blisters and minor cuts. Option D. The increasing popularity of adventure sports and expeditions, coupled with a rise in associated injuries and fatalities, which necessitated a more structured and evidence-based approach to medical care in remote environments. The correct answer is D. The increasing popularity of adventure sports and expeditions, coupled with a rise in associated injuries and fatalities, which necessitated a more structured and evidence-based approach to medical care in remote environments. Explanation: the control framework reveals that the historical context and evolution of wilderness medicine are not merely academic curiosities, but directly inform current best practices and regulatory compliance within the FAWM framework. Understanding the genesis of wilderness medicine, from early expeditionary medical support to the development of specialized training and protocols, is crucial for a FAWM candidate to appreciate the rationale behind existing guidelines and to anticipate future developments. This scenario is professionally challenging because it requires a candidate to synthesize historical knowledge with practical application, demonstrating an understanding of how past challenges and innovations have shaped the present-day regulatory landscape of wilderness medicine. A candidate must move beyond rote memorization of historical facts to grasp the underlying principles that have driven the evolution of the field. The correct approach represents best professional practice because it demonstrates a deep understanding of the foundational principles that underpin wilderness medicine. By recognizing how early pioneers addressed limitations in resources and communication, and how these experiences led to the development of standardized protocol and risk management strategies, a candidate shows an ability to critically evaluate current practices. This historical perspective allows for a more nuanced and adaptable approach to wilderness medical scenarios, aligning with the FAWM emphasis on evidence-based practice and continuous learning. It also implicitly acknowledges the ethical imperative to learn from past successes and failures to ensure the highest standard of care for individuals in remote environments, a core tenet of wilderness medicine ethics. An incorrect approach would fail to connect historical developments to current practice. For instance, focusing solely on the technological advancements of a specific era without considering the underlying medical principles or the ethical considerations that drove those advancements would be a superficial understanding. This would represent a regulatory failure by not fully engaging with the spirit of the FAWM curriculum, which aims to foster comprehensive competence. Ethically, it would be a failure to leverage the collective wisdom of the field, potentially leading to an over-reliance on current tools without understanding their limitations or the historical context of their development. Another incorrect approach might be to dismiss early medical practices as primitive without acknowledging their ingenuity and the significant impact they had given the constraints of their time. This would be a failure to appreciate the evolutionary nature of medical knowledge and could lead to a lack of respect for the foundational work that has enabled modern wilderness medicine. Such an approach would also fail to recognize the ethical lessons learned from past challenges, such as the importance of preparedness and resourcefulness. Professional decision-making in similar situations requires a commitment to lifelong learning and a critical, reflective practice. Candidates should actively seek to understand the why behind established protocols, tracing their lineage back through historical developments. This involves engaging with primary sources, historical accounts of expeditions, and the evolution of medical literature in remote settings. By doing so, professionals can develop a more robust understanding of the field, enabling them to adapt to novel situations and contribute to the ongoing advancement of wilderness medicine. Question 18. Which approach would be most appropriate for a wilderness medicine provider leading a group on a multi-day trek to a high-altitude leg, when several members begin reporting mild headaches and fatigue on the second day of ascent, with the planned summit day still 2 days away? Option A. Administer prophylactic altitude sickness medication to all group members and continue with the original ascent plan, assuming the medication will prevent any significant issues. Option B. Encourage continued ascent at the planned pace, advising members to hydrate well and take over-the-counter pain relievers for headaches, while closely monitoring for worsening symptoms. Option C. Recommend immediate descent for all members experiencing any symptoms of headache or fatigue, regardless of severity, to prevent potential progression of altitude illness. Option D. Implement a strategy of slower ascent for the remainder of the trek, incorporating rest days at current or slightly higher altitudes, and encouraging thorough hydration and avoidance of alcohol. The correct answer is B. Encourage continued ascent at the planned pace, advising members to hydrate well and take over-the-counter pain relievers for headaches, while closely monitoring for worsening symptoms. Explanation. This scenario presents a common challenge in wilderness medicine, managing a group's acclimatization to altitude in a remote setting where rapid descent is not always feasible or desirable. The professional challenge lies in balancing the physiological needs of individuals with the expedition's goals and safety protocols, all while operating under the FAWM implicit guidelines for responsible wilderness medical practice, which emphasize evidence-based care and risk mitigation. The correct approach prioritizes gradual ascent and proactive symptom management, aligning with established acclimatization principles and the FAWM emphasis on preventing altitude illness. This strategy minimizes the risk of severe acute mountain sickness, AMS, high-altitude cerebral edema (HACE), and high-altitude pulmonary edema (HAPE), which are critical concerns in wilderness environments where advanced medical care is distant. This approach represents best professional practice by adhering to the scientific understanding of acclimatization, which dictates that the body needs time to adapt to reduced oxygen availability. It also reflects an ethical commitment to the well-being of the expedition members, placing their health above the strict adherence to a predetermined itinerary when physiological responses dictate otherwise. An incorrect approach that ignores early symptoms and pushes for continued ascent, despite signs of AMS, fails to uphold the professional duty of care. This disregards the physiological reality of altitude sickness and the potential for rapid deterioration, creating a significant ethical failure by knowingly exposing individuals to increased risk. Another incorrect approach, such as immediate descent for any mild headache, while seemingly cautious, may be professionally inefficient and unnecessarily disruptive if the symptoms are indeed mild and manageable with rest and hydration, failing to apply nuanced judgment based on the severity and progression of symptoms. A third incorrect approach, relying solely on prophylactic medication without considering individual responses or the need for behavioral adjustments, is also professionally deficient. While medication can be a tool, it should complement, not replace, fundamental acclimatization strategies like gradual ascent and recognizing physiological cues. This approach risks masking symptoms without addressing the underlying physiological stress, potentially leading to a false sense of security and delayed recognition of serious illness. Professional decision-making in such situations requires a systematic assessment of the group's condition, an understanding of altitude physiology, and the ability to adapt plans based on real-time data. This involves continuous monitoring of individuals for signs and symptoms of altitude illness, open communication within the group, and a willingness to modify the expedition's pace or objectives to ensure safety. The FAWM framework implicitly supports this by promoting a culture of preparedness, risk assessment, and evidence-based medical decision-making in austere environments. Question 19. The review process indicates that a participant with a history of mild, well-controlled asthma is planning a trek to 4,000 meters. While the individual reports no recent exacerbations, their medical history includes occasional shortness of breath during strenuous exercise at sea level. Which of the following approaches best reflects best practice in evaluating this participant's suitability for high-altitude acclimatization? Option A. Recommend a thorough pre-trip medical evaluation by a physician experienced in environmental medicine, including assessment of pulmonary function and a discussion of potential altitude-related respiratory symptoms and management strategies, with a clear plan for monitoring and evacuation if symptoms worsen. Option B. Provide general advice on avoiding strenuous activity at altitude and suggest they carry a standard rescue inhaler. Without a specific medical evaluation, Option C. Allow the participant to proceed with acclimatization without further medical assessment, assuming their asthma is mild and well controlled. Option D. Advise the participant that any history of asthma contraindicates high-altitude exposure due to the increased risk of severe respiratory distress. The correct answer is A. Recommend a thorough pre-trip medical evaluation by a physician experienced in environmental medicine, including assessment of pulmonary function and a discussion of potential altitude-related respiratory symptoms and management strategies, with a clear plan for monitoring and evacuation if symptoms worsen. Explanation. Scenario analysis. This scenario presents a professional challenge in wilderness medicine by requiring the evaluation of an individual's physiological response to a specific environmental stressor, high altitude, in the context of pre-existing medical conditions. The FAWM framework emphasizes evidence-based practice and patient safety, particularly when managing individuals in remote and potentially resource-limited environments. The challenge lies in balancing the potential benefits of high-altitude exposure for acclimatization with the inherent risks associated with exacerbating underlying cardiovascular or respiratory conditions, all within the scope of wilderness medicine practice. Correct approach analysis. The correct approach involves a comprehensive, individualized assessment that prioritizes patient safety and adheres to established wilderness medicine guidelines for managing individuals with pre-existing conditions at altitude. This includes a thorough medical history, a detailed physical examination, and consideration of the individual's specific cardiovascular and respiratory status. The decision to proceed with acclimatization should be based on a risk-benefit analysis, potentially involving consultation with specialists if available, and a clear plan for monitoring and emergency management. This aligns with the FAWM commitment to responsible practice in challenging environments, ensuring that medical decisions are informed by the best available evidence and tailored to the individual's unique physiological profile. Incorrect approaches analysis. One incorrect approach would be to dismiss the individual's pre-existing condition as irrelevant to high-altitude physiology, proceeding with acclimatization without further assessment. This fails to acknowledge the potential for environmental stressors to unmask or worsen underlying pathologies, a critical ethical and professional failing in wilderness medicine. It disregards the principle of do no harm and the FAWM emphasis on thorough patient evaluation. Another incorrect approach would be to prohibit any high-altitude exposure solely based on the presence of a pre-existing condition, without a nuanced assessment of its severity and the individual's overall fitness. This represents an overly cautious stance that may unnecessarily restrict a patient's ability to participate in activities, failing to consider the potential for carefully managed acclimatization under appropriate supervision. It lacks the individualized risk assessment that is central to best practice in wilderness medicine. A third incorrect approach would be to rely solely on generic advice for high-altitude travel without considering the specific nature of the individual's pre-existing condition. This overlooks the fact that different cardiovascular and respiratory conditions have varying implications for altitude tolerance. It demonstrates a lack of specialized knowledge and a failure to apply the principles of environmental physiology to individual patient care, which is a cornerstone of FAWM expertise. Professional reasoning. Professionals in wilderness medicine must adopt a systematic approach to patient assessment in environmental physiology. This involves 1. Understanding the specific environmental stressor, e.g., altitude, cold, heat, and its known physiological effects. 2. Thoroughly assessing the individual's baseline health, paying particular attention to any pre-existing conditions that might be exacerbated by the environmental stressor. 3. Conducting a risk-benefit analysis, considering the potential positive and negative outcomes of exposure. 4. Developing a personalized management plan that includes appropriate acclimatization strategies, monitoring protocols, and emergency preparedness. 5. Recognizing the limits of one's own expertise and seeking consultation when necessary. This structured approach ensures that decisions are evidence-based, patient-centered, and ethically sound, upholding the highest standards of wilderness medicine practice. Question 20. The analysis reveals a 55-year-old hiker experiencing sudden onset chest pain radiating to their left arm, accompanied by diaphoresis and shortness of breath, approximately 12 hours from the nearest advanced medical facility. The patient has a history of hypertension. Considering the limited resources of a remote wilderness setting, which of the following management strategies best reflects the principles of wilderness cardiac emergency care? Option A. Initiate immediate intravenous fluid resuscitation and administer a broad-spectrum antibiotic to address potential underlying infection contributing to symptoms. Option B. Focus solely on symptom relief with analgesics and await definitive medical care at a hospital, avoiding any cardiac-specific interventions in the field. Option C. Administer aspirin and sublingual nitroglycerin if blood pressure permits, while preparing for rapid evacuation and continuously monitoring vital signs and pain levels. Option D. Attempt to administer a beta blocker to reduce myocardial oxygen demand, even without a clear diagnosis of myocardial infarction, to preemptively manage potential arrhythmias. The correct answer is C. Administer aspirin and sublingual nitroglycerin if blood pressure permits, while preparing for rapid evacuation and continuously monitoring vital signs and pain levels. Explanation. The analysis reveals a scenario where a wilderness medicine provider faces a patient exhibiting symptoms suggestive of a cardiac emergency in a remote setting, far from definitive medical care. The professional challenge lies in the limited resources, the delayed evacuation timeline, and the potential for misdiagnosis or delayed appropriate intervention, all of which carry significant implications for patient outcomes. The provider must balance the urgency of potential cardiac compromise with the realities of wilderness medicine, including environmental factors and the patient's overall condition. The correct approach emphasizes a systematic, evidence-based assessment and management strategy tailored to the wilderness environment. This involves recognizing the signs and symptoms of acute coronary syndromes (ACS) or other life-threatening arrhythmias, initiating appropriate interventions within the scope of practice and available equipment, and establishing a clear plan for evacuation and definitive care. This approach aligns with the ethical duty of care and the professional standards expected of FAWM certified individuals, prioritizing patient safety and well-being while operating under challenging constraints. It reflects a commitment to applying advanced wilderness medical knowledge to a critical situation. An incorrect approach that prioritizes immediate, aggressive pharmacological intervention without a thorough assessment or consideration of contraindications would be professionally unacceptable. This could lead to iatrogenic harm, such as precipitating hypotension or exacerbating bleeding risks, and would violate the principle of do no harm. Another incorrect approach, such as delaying definitive management or evacuation due to uncertainty or a desire to avoid potential complications of treatment, would fail to meet the standard of care for a suspected critical cardiac event, potentially leading to irreversible myocardial damage or death. This would represent a failure to act decisively when indicated and a dereliction of the provider's duty to advocate for the patient's best interest. Professional decision-making in such a scenario requires a robust framework that integrates clinical assessment, knowledge of wilderness medicine protocols, resource availability, and risk-benefit analysis. Providers must continuously reassess the patient, adapt their management plan based on evolving signs and symptoms, and communicate effectively with any available support or evacuation teams. The FAWM curriculum emphasizes this iterative process of assessment, intervention, and reassessment in the context of remote environments.